Hi, I'm Kendra Edwards, and welcome to the Cardon Resource Hub. And today we're going to be talking about Medicare Advantage plans and special needs plans. And we're excited to have Danielle Biedermann here with us. And I'm going to turn it over to her. Her talk us through how to navigate all of that.
Thank you, Kendra. I'm so excited to be here and hopefully help provide some resources, as Kendra mentioned, to navigate Medicare, to navigate open enrollment, and talk about some specific Medicare Advantage plans and special needs plans. So just to give a really high level overview to start out with. So traditional Medicare is the plan when you turn 65 that is based on earnings and that you've worked for typically through your own employment, but oftentimes we do see residents who have received Medicare benefits through a spouse and sometimes even a parent. The other type of Medicare that we can see is if someone is under the age of 65 and they have been disabled for 24 months or 2 years is another type of Medicare that we see. So traditional Medicare has 3 parts. So Medicare Part A, Medicare Part B, and then Medicare Part D. So Medicare Part A is what covers hospitalizations, short-term rehabilitation in a skilled nursing setting. There's home health benefits, and hospice services are covered under Part A. So covered under Medicare Part B would be doctors, outpatient services. So if an outpatient procedure, outpatient therapy, or for our long-term care residents, if they're receiving therapy not under a skilled stay, is covered under Part B. There's additional home health benefits covered under Part B, as well as durable medical equipment. With Medicare Part B, it is a voluntary program that you have to enroll into. But the majority of folks, when they sign up for or are eligible for Medicare Part B, do also add Medicare Part B to their benefits. There is a monthly premium that comes along with Part B that typically is handled before Social Security benefits are paid, but most of beneficiaries do have a premium for Part B benefits. The third type of Medicare, or the third part of Medicare, is what's called Medicare Part D, and that is what covers prescription drugs. So again, that is an optional portion of Medicare that you do have to partner with an outside health company for. So sometimes that's through retirement or employee benefits, or sometimes it's just through an insurance company who provides the Part D benefits. Again, there's typically a premium with that, but it varies person to person and situation to situation. So there's another type of Medicare, and we're probably very familiar with this, especially during open enrollment, what's known as Medicare Advantage. And what these are Medicare plans that provide Part A, Part B, and Part D all bundled together. So what happens is CMS and Medicare partners with approved health companies that have to follow all of Medicare's rules and provide all of the benefits that are covered under Part A, Part B, and Part D. So anytime someone goes to the hospital, skilled nursing facility, physicians, all of those benefits that we previously mentioned have to be provided at a bare minimum by Medicare Advantage plans. There is also a fourth part to these types of plans, which is known as a Part C. And those are supplemental benefits that are on top of anything that traditional Medicare provides. And Part C benefits often include benefits such as hearing, dental benefits, vision, podiatry, transportation services, over-the-counter products. They all vary plan to plan and are sometimes specific to the type of plan that is out there. So there's quite a few different types of Medicare Advantage plans. that we see in the market. Some definitely are more prevalent or more familiar maybe than others. So the first two, I'm going to just mention at a basic minimum that we tend to see are HMO and PPO type plans. Those are going to be, again, cover all of the Medicare traditional benefits that we see, the Part A, the Part B, and the Part D. Where they tend to have the biggest differences in those types of plans is more of out-of-pocket cost, in and out of network providers and requirements surrounding networks, as well as authorizations required for certain services. So those tend to be, the biggest differences in those types of plans. What we want to focus on today is maybe some of the little less known types of Medicare Advantage plans that are out there. And those are what are called special needs plans. So there's several different types of special needs plans that Medicare designates kind of a separate type of benefit and a separate bucket, and different requirements that people are eligible for with these types of plans. And so there's a multitude of different types that are out there. We want to focus on two today. The first one being what is called an ISNP. It's an ISNP is the acronym. It stands for Institutional Special Needs Plan. And the other type of special needs plan is what's called a DSNP or a DSNP, which is a dual eligible special needs plan. So to start with, we'll talk about the ISNP, Institutional Special Needs Plan. This is a Medicare Advantage plan. So again, at a bare minimum, we have to cover everything that is covered under traditional Medicare, Part A, Part B, and Part D. These Medicare Advantage plans are specifically designed for residents who live in a long-term care skilled nursing facility. And it's not just every facility. The facility has to partner with a health plan to provide this type of program. And then that program then turns around and provides benefits to residents who sign up for this program. So big thing with this, again, it's not available everywhere. It has to be facility specific and specific to the health plan that the community has partnered with. So to be eligible for this type of Medicare plan, residents must have Medicare Part A and Part B, whether that's through traditional Medicare or through another Medicare Advantage plan. That's kind of the basic requirement, as well as living in a skilled nursing facility for at least 90 days or longer. So again, the goal here is long-term care residents. This is not something that a short-term resident who's planning to return home. This is not a plan that someone would want to sign up for if the goal is to stay short-term. The big thing with these types of plans outside of what's covered by traditional Medicare are those supplemental benefits. And the first one, and probably the biggest benefit for our residents and their families, is that care oversight is provided through these plans through a nurse practitioner, and oftentimes an RN care coordinator also comes with these types of plans. And the goal is really to provide and facilitate, treating in the facility as much as possible. So identifying changes in condition as early as possible. We all know that hospitalizations are really stressful for everyone. They're really difficult on the resident, for their families. It can be very confusing, can mess up medications. All of those things can be really difficult. And so if we're able to, capture and identify changes in condition as early as possible, treat them in the facility where the resident lives, that's going to be the most, calm type situation that we can provide. There are going to be instances where a hospitalization is appropriate. So that's definitely still, a covered benefit and a covered service. But the goal really is provide that care oversight in the building. These nurse practitioners tend to have a much smaller caseload. So they're on top of anything that is provided by the community. So the physician still stays involved, all of the nursing care. This is just an added layer to help facilitate advanced care planning. So all of those conversations surrounding goals of care, how aggressive or not aggressive do we want to be? What does the disease trajectory look like? All of those things are communicated by the provider directly to and with the resident and their family. So again, huge communication added layer that's provided by these. Managing those changes in condition on site is the big goal. There's also additional supplemental benefits that come along with this type of plan, and every plan varies just a little bit on what they offer, but the majority of them, again, are geared towards long-term care residents. So they're offering those additional benefits like hearing, vision, dental, additional podiatry visits, non-emergent transportation, so help with transporting back and forth to external doctor's appointments as needed. A lot of times there's over-the-counter product catalogs that residents and their families can order from. Some of them even offer, grocery benefits and things like that. So again, it's really geared towards and tailored for the residents that live in a long-term nursing care setting. The last type of special needs plan that we want to mention are those dual eligible special needs plans. So again, these are also Medicare Advantage plans that are designed for residents who are dual eligible, meaning that they have both Medicare Part A and B, as well as Medicaid. So both of those types of health plans have to be involved in this circumstance. These types of plans do not have the location specific like the I-SNP does, where they have to live in a long-term nursing home. These types of plans can be offered anywhere. People that live at home, assisted living, nursing facility, all of that. So again, they're Medicare Advantage plans. So they're covering everything that Part A, Part B, and Part D covers, as well as some extra benefits for residents who are Medicare and Medicaid eligible. I always say, again, you can live anywhere, and these types of plans are great for Medicare and Medicaid individuals. I always say they're great for folks that live at home, because a lot of times they add some additional wraparound benefits. So there's usually assistance with groceries, assistance with utilities, those types of benefits, again, really specific for people that live at home. But we do have residents in the long-term care setting who do have them. The big difference in this type of plan versus the I-SNP special needs plan is that there is not the care oversight by the nurse practitioner. So again, as we talked about with I-SNP, the facility has to partner with the health plan, and with that, then all of these extra benefits and clinical support are provided. The D-SNP plan does not have that type of partnership and those extra clinical support pieces that the I-SNP has. So that's really kind of the big difference. Again, they're both Medicare plans. They're going to cover the basic Medicare benefits, but they don't have that clinical support and that clinical model like the I-SNP has. So the big questions that I get is how do I enroll in one of these plans? So Medicare has every year open enrollment. It falls every year at the same time, October 15th through December 7th. This is a great opportunity for Medicare beneficiaries to sit down and look at what they currently have as far as their health plan and their Part D coverage, and then look at options that are out there in the market. So any changes that are made during open enrollment become effective January 1st of the following year. So we have a couple of months at the end of every year to take a look at our Medicare benefits, see if it's a good fit, if there's different options that are available, and then have some time to talk to different representatives. I spent a lot of time as a business office manager, and the biggest question that I would get every year was, do I have to do anything? And the answer to that question is no. There essentially is no action required if you are happy with your current coverage. So if everything is the way that you want it to be, you don't have to take any action. However, there are plenty of options out there and plenty of different types of Medicare. So again, it's a good opportunity, I think, to at least explore the different options that you have with Medicare and see if there might be something that's, a good fit for you or your loved one. Open enrollment every year comes with lots of outreach. So you'll see, especially for 2024, kind of that normal open enrollment outreach that you'll see through commercials, mailers. We'll see booths set up at, your pharmacy and grocery stores, and all of that will continue. This year in 2024, in preparation for benefits in 2025, there will be a couple of changes or new additions probably to the outreach that is done. So anticipate, if your loved one has Medicaid through the Indiana Pathways program, that you may also receive outreach from your loved one's Medicaid provider, letting you know about the Medicare benefits that they also offer. But then also, you'll hear outreach potentially from your specific community on what I-SNP options are available. So again, if you remember with I-SNP, it's not available everywhere. So that outreach will come directly from someone at the facility. It won't come from an external provider originally. You'll hear directly from someone here at the community level, letting you know that the options that are available at that specific community. There also is a great resource. Medicare.gov is a great resource to start looking at side-by-side options. 1-800-Medicare is also a great resource to start with. Individual health plans also have their own websites that you can take a look at plans that are available in your specific area. That's all that I have. I appreciate the time that we had today. Hopefully this answered a lot of questions and eases some confusion. I do highly recommend, if your loved one is in a community, that as you are looking through options during open enrollment and into 2025, to work with your community team to help answer questions that you might have, looking, at benefits side by side, seeing what's available to you and to your loved one to get them the best care and best health plan to fit your needs.